be na no a dentist I didn't ever show you so. Obaso pen I can send be and no yes aba beto so. Na no questions be ho no I know say nipa bebrebe wo afa yes ho ane enum ankasa senior enum nyina na ho nti e ya de abeka ni nyina ho asem. Enti ye jinkrato kakra bi yenche just about a minute. Ye buy no one to say do nyina no ebrem. Nti mo my 1 minute ye ba sese a.
Minia ba eni ma medufi oye dwuma odukasi anopa biara minia ba sori ahoɔden mu na ɔkɔdwuma on complaining da sɛ ho ba bitutu no sanso na mebra o efitani o tu engine no opagya engine de ka adwuma sɛ de sitie da bi biara no ho dendenden mia meyire o store no adi ni dwa meyire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanam papa ne mfia konkan ɔno so complaining da sɛ de ho ba bia ne ya ɔsori anopa na no afanse kan no ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de beda mpo na adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gira se your secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a wonom a ebo nipadua no ema wo si pi usita me kanfo ama wo se won so no nom kowa mesani bi na baboa na aboa no abusua na yare da ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. Say wo pe kwa mixture ato ewa America abrochi memu called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem
FDA ahwehwe edwadie nkratuo yi agiatum se eye.
Just one more pic, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.
World Remit, a better way to send money. Download the app or visit worldremit.com.
We mamo akwa babio asaba akọ radio so asem di ka kan no ene ye ne a dentist na ebetwetwe nkomo na sada me kan wa baso paint ma me na akwa aba na ye hwe sire besi akọ no about ye mo akọ radio.
Thank you so much for having me.
Yes, and then one money to as me come here, also thank you so much. And then the Cassan Basso Saka Cranjimoa, grandma and grandpa, no mama tam kakra, and then be a better church kakra. But my man church, mamma fancy me, and then be a bit be an asani ever come. And see, Monshano Sumaye, so the bay a bit my bomber be a cosso. Abel, I mean, you've been here before, so, but there are a lot of people that doesn't know you. So, can you please tell us a little bit about yourself?
Sure. My name is Beryl Octchere. I am a general dentist. I've been practicing for the last few years here in Ohio, and then now here in Texas. And I'm here to talk a little bit more about dental health and wellness.
Well, thank you. That was a quick one. I know you have a presentation, so we're not going to waste much time. We're just going to go into it, and then after that, I will just bombard you with all the questions.
Okay, sounds good. Okay, is the presentation showing, or should I?
No, yeah, I'll get it up for you.
Okay, yeah, I'll talk more about myself as well when I go to that page, but Yes, so today we're talking about oral health as it pertains to Ghanaians. So I'll talk about some general concepts, but I also want to relate it specifically to us as a community, the trends we see back home, but also it follows us here because we bring the same thoughts and behaviors here, and some of the things that people have asked questions about in the past, just select topics that I want to go over as well that will help us to basically learn a little bit more about some of the things we've been doing and also hopefully change some of our mindset on dentistry. So, with the presentation today, I'm going to go through a little bit of how to prevent diseases in your mouth, dental disease, and then I'm going to talk more about how we're seeing these oral diseases present in Ghana, and also the chewing stick, which is a very commonly used thing or a supplement or aid, or even for some people a substitute. So we'll talk a little bit more about that. We'll talk a little bit about charcoal and that's its use as well. And then also we'll talk about untreated dental decay, which I'll go into more at the time that we get to that part. So now I'll talk a little more about myself. Like I said, I shared my name. I am a general dentist. I obviously a Ghanaian, but grew up mostly in Dallas, Texas. And I went to dental school in Houston, currently living in San Antonio, Texas. And I have a picture here of my family. I have a almost 3-year-old girl and a 10-month-old baby boy, and that's my husband as well. And so that's a little bit more about me. And got into dentistry because I really became fascinated with that field. And I realized nobody in my family did it. I didn't know a lot of dentists, but I had interest in it. So I came into that field a few years ago, and it's been a very good experience. And I've realized, especially as a Ghanaian, there's a big opportunity to educate people because it's not something that we talk about as much back home. So I'm very excited to always have the opportunity to talk about dentistry. And I have a quote here, and I have my son smiling because he has 2 teeth, but with his 2 teeth, he smiles. And it says, use your smile to change the world. Don't let the world change your smile. So we all want to smile, and that's kind of what this is about. So I'm going to start off broad and then get into specific topics. So just an introduction to oral health. Why is this important? Why do our teeth matter? Other than just being there in our mouth, what do we actually use them for? Well, they're important for nutrition because I always say it, digestion starts in the mouth. If you can't chew, imagine you could not break down your food. That means that you're not going to really get the nutrients you need. So nutrition starts with the teeth in the mouth. And if you have teeth that are broken, if you have teeth that are infected, if there's cavities, gum disease, if your teeth are moving, once you have those issues, then you'll realize how important your teeth are. If you don't have those issues, then maybe you might not see that. But for nutrition, the second important function is speech. If you lose certain teeth, especially your front teeth, your speech changes. Have you noticed a child who's like kindergarten age who they start to lose these teeth and they're like, I lost my teeth, and like they can't talk? Our teeth actually help us to produce speech. So they're very important. And then aesthetics, which may seem not that important, but it's very important because a lot of times if there's some issues with your mouth and you can't smile, it affects your confidence, your ability to interact with people, get a job, work in certain career fields. Again, if you haven't had that issue, maybe you won't think about it. But for those who have those issues and they don't like the way their teeth look for different reasons, they could be stained, they could be discolored, they could be broken. It can affect them. And I've seen patients of mine who have their smile transformed and now they feel enabled and equipped to go into the workforce and maybe even finding a life partner and different things. So nutrition, speech, aesthetics, all very, very important. And the other reason it's important is that oral health can affect your overall health. There's a huge link that we're seeing. If you look at the image, the words are kind of small, but huge links between oral health and heart disease, diabetes, hypertension. And we're seeing that people with gum disease are more likely to have a lot of these issues. And people who have something like diabetes, their gum health is affected, their, all of these other things. And so there's a huge link. And so you don't want to neglect your oral health because in turn you're neglecting your overall health. But in short, it can affect your diet, nutrition, sleep. Imagine you have a toothache and you can't sleep. Your tooth is just hurting. Psychological status, social interaction, school and work. It's the major portal of entry into the body. So a lot of bacteria and different things start in the mouth and they can spread. So it's very important that we take care of our dental health. And so quickly, I always like to talk about prevention or how to keep your teeth clean and healthy. And then we can go into more details after that in my presentation. But number one way is manual toothbrush. So just your regular everyday toothbrush, using that 2 times a day. 2 times a day for 2 minutes. And the diagram shows you different ways to go about that. It shows you you should get every surface, front, back, chewing surfaces, sides. And it shows you also you can use a 45-degree angle so that the bristles kind of touch into the gum line a little bit. And you can also, it doesn't show that here, but you can kind of do circles when you're going around. So you can angle it, you can do circles. Basically, the purpose here is to get every surface of your teeth clean so that food and plaque and bacteria doesn't have a chance to sit on your teeth. When they can sit on your teeth, that's when you see other issues like cavities, infection, etc. So brushing your teeth 2 times a day, morning and evening, for 2 minutes is the number one way to prevent dental disease. The second way is actually flossing your teeth. And so we should all be hopefully familiar with floss. You can buy it the same place you buy your toothbrush, your toothpaste. You should be flossing once a day. And a lot of people are not in that habit, but once you get in the habit, it's better for you. So that's going to help prevent a lot of issues. As this picture shows, you can roll it up and put it around your finger. There's different other types of flossers, but flossing is very important. And this picture just shows you actually before and after a dental cleaning in a dental office. So if you're seeing a dentist, which you should hopefully be seeing a dentist, we'll talk a little bit more about the trends we're seeing as far as Ghanaians and dentistry, but hopefully you should be seeing a dentist. And if you came in with the top picture, you would leave with what the bottom picture looks like. Basically, a professional cleaning is where we use special instruments to remove all of the buildup, the plaque, the stains, and all of that. And it's very important because even though you're doing your job at home, you're brushing, you're flossing, and even for people who have very good oral health, the cleaning really helps to get a little bit deeper and really get everything cleaned out very well for you. So prevention would be brushing, flossing, seeing a dentist is the main thing. And so now I'm going to hone in on specific to our homeland, Ghana, and kind of talk about some of the trends that have been seen and prevailing thoughts that are going on in Ghana. The disclaimer for me is that I haven't really lived in Ghana. So I visited, and so I'm going off of what I've been told and also the studies I'm reading and also what I'm seeing amongst our community in the U.S. So I can't speak specific. It might not be 100% accurate to what is happening there, but I know what I've seen around Ghanaians that I know, my family and everything like that. And my husband was a big resource too because he was raised there, so he helped me understand. Basically, my question for him was like, what was your attitude toward the dentist growing up? And he's like, there was no attitude. He's like, we don't go unless you have a problem. You don't go. He's like, that was it. And so that helped me understand a little bit better. So there's a study that I utilized that actually they just published it this year. Assessment of oral health status in the Ghanaian population, rationale, methods, and population characteristics. So a group of Ghanaian dental professionals in Ghana took a lot of time to do a very in-depth study here recently. They did it's a cross-sectional study. They crossed all their things off. They really tried to make it thorough, and it's a certain sample size, but they tried to make it hopefully representative of some subsect of the population. So what they were looking at is how many people are going to dentists, what are people's attitude toward dentists, when do they go. They'll look at rural areas versus metropolitan areas, which they look at like Accra and Kumasi, and then they look at like outer areas. They broke it down. So a few things that they found a lot of things, but these are some of the common things they saw. They saw that overall oral health was seen as a very low priority. So basically, like people, it wasn't something where you felt like you need to be going regularly or anything like that. They found that dentists and dental clinics were concentrated in what they called metropolitan areas. So it's like you'll find so many dentists now in Accra, but you won't find them in some of these other outer lying areas. So when you look at it all together, the ratio of dentists to population was very low. And for that reason, there was a low utilization of oral healthcare services. I kind of skipped down to one in the bottom, but there was a low utilization of the services because in some places you can't even get access to it. Other places there's access, but again, it's not seen as a high priority. And that's even right. This is a modern recent study. And so also for that reason, you see a lot of untreated gingivitis and periodontal disease. So gingivitis would be if your gums are inflamed, bleeding. Periodontal disease is like they're bleeding and inflamed, but also there's this underlying issues where the bacteria has gone into the gums and it's actually affecting the gums by breaking it down. You see the gums should start here, but they've receded down the tooth. So we're seeing a lot of that and also seeing tooth loss, dental caries and retained roots. And Retained roots means like the tooth has broken off. It broke down, it broke off. So basically, the people were presenting for the study as subjects for the study, and they have sometimes multiple issues in their mouth that they were completely unaware of, or maybe they're aware of, but again, not seen as a high priority. So, then this is generally speaking. Obviously, there's exceptions, and there's certain areas or people who have more access or more. It's more of a priority, but this was the general thing they saw. They saw that almost 90% of the dental clinics were located mostly in like the city center of like Accra and Kumasi. So there were very few in other districts and other outer areas. They also found that overall, 34% reported ever seeing a dentist. So almost like a third of people ever had in their life gone, which I don't know if that's expected or unexpected or that sounds accurate, but it's a low percentage. I will say in the U.S. And maybe some other Western countries, dentistry is still not like at 100%. Like it's still like a lower percentage, like anywhere from 50 to 75. So we're seeing that in most places, dentistry isn't that thing where everybody's going, but this is pretty low to have 34%. And then the 4.7% means that so out of those people who had problems in their mouth, that was the percent that had actually gone to a oral health care facility, which it sounded low. Maybe I was reading the number wrong. That sounded very low because I'm thinking that people were in pain, they would at least go. But that's the number that they had listed, which was out of people who determined that, hey, I have some sort of issue in my mouth, that little 5% was who actually said, I'll go to dentist. So, so I have some kind of quotes that I'm going to like read and then discuss and then go through what the conclusions are from the study. So though the causes of oral diseases are largely genetic, microbiological, behavioral, and social. Sorry, I read that wrong. Though the causes of oral diseases are genetic and microbiological, behavioral and social factors such as community, cultural values, health beliefs, attitudes, and knowledge of dental care delivery system greatly influence oral health. So basically, even though there's all these factors like genetics, microbiology, really what's guiding the behaviors is really the culture and the society, social factors, community culture that guides influence oral health. Because what we're seeing here is historically it has not been seen as a priority. It's not really something that people are doing commonly. It's not like you go to your 6-month cleaning every time you're going and seeing the dentist every 6 months. And so that has influenced what we're seeing in oral health. And on this quote, I'll just highlight that they mentioned fluoride would play a vital role. So fluoride is a chemical or a mineral, I guess you could say, that prevents dental cavities. They found over time that particular mineral can make the teeth stronger. So in the United States and many places, they put fluoride in drinking water. And then we also put fluoride in the toothpaste. When you go to a dentist, we can also directly apply fluoride, like we paint it onto your teeth, especially children. It's very important for children. We found that fluoride in public health is huge because it makes such a big difference in keeping people's teeth healthy and helping them to keep their teeth. In Ghana, they found that there are certain water sources that have natural fluoride, but I mean, there's not really an emphasis or a move to put fluoride in other water sources, and that makes a huge difference. So that's one thing that they've noticed. And the other thing they've noticed is that many African communities have their own traditional oral health practices, and I'll go into that soon, which is going to be things like the chewing stick and charcoal and things like that. So overall, all of these things have contributed to people just saying, hey, we're doing what we're doing and it's working. We don't really need to see the dentist. So overall, the conclusions that were drawn was that the metropolitan areas have more dental clinics, but not people aren't necessarily utilizing them, so they still have more dental disease. And there's a lot of caries, which caries is a dental cavity, which I didn't go into that explanation per se, but a cavity is basically when bacteria has time on your tooth. It produces byproducts that actually break down your tooth to where you have a hole in your tooth. So that's a cavity. And that can eventually become infection if it becomes bigger and deeper. But that prevalence is low overall, but we do see that people do have them and they're not treated, mostly untreated. So people are walking around with them and probably not really seeking out any sort of treatment until it's causing pain. So overall, oral health has not generally been prioritized for the most part. And so what is the conclusion there? What does that mean for us? Well, what that means is for us is that there do need to be more effort aimed at oral health education and promotion throughout Ghana, but also to Ghanaians abroad. So that's something that I'm passionate about, and I do whenever I'm called upon to talk. I do love to talk about oral health in different settings, and I know there's a lot of Ghanaian dentists who are doing that and trying to influence the way things are done back home. But this whole presentation hopefully will educate you and encourage you to also really prioritize your dental health. It is important. It affects your overall health. And not just maybe you'll say, oh, I'm overall healthy, I don't have any problems in my mouth, but prevention is better than cure. So seeing a dentist regularly is really what's going to help you to prevent a lot of these things and help you to stay healthy. So education programs should also be targeted to at-risk populations. And so anyone who really doesn't have much access to care at least needs more education, because at least if people aren't seeing the dentist, but they understand that they should be brushing twice a day, flossing, all these things, it's going to help them. So those are the conclusions from the study. And another takeaway for anyone watching is just to, like I said, try to prioritize your oral health, because it's so important. And there's a lot that can go wrong if it's not a priority. Also, once you lose your teeth, once your teeth get broken or you come out or you lose them, you don't get them back. When you're an adult, you just have that one set. And remember what I said: nutrition, speech, aesthetics. Those are so important, and you want to make sure you take care of them. So now I'm going to go into specific topics that I found. There's probably more I could have talked about, but I just went into a couple things that I'm like, okay, these are common things that we see back home, and are they useful or not? So the chewing stick is actually one of the oldest known oral hygiene tools. It's not just us. A lot of Middle Eastern countries, Asian countries, and African countries. It's widely considered the most effective primitive oral hygiene tool. It's also called miswak, which I think is Arabic because, like I said, Pakistan and some of these other Middle Eastern countries or Muslim nations, I know they use them. So it actually contains a lot of chemical components. It depends on which plant they get it from. There's different plants that they have specifically chosen, like historically, to use to make the chewing stick. But it contains many chemical components that are beneficial for oral health. So I have mostly positive to say about the chewing stick. It's actually very, very useful. And I found in my studies that it's actually been endorsed by the World Health Association, but it's been deemed as a substitute to modern manual toothbrush to prevent oral diseases in countries with restricted oral health care. So what they're saying is that this is definitely useful. It's definitely helpful. If you have access to toothbrushes, let that be your first choice. If you don't, this is all you have, that's fine. And it can be helpful and it can work very well. If you have access to both, it's saying it can be a supplement. We would still use both a manual toothbrush and a chewing stick. But basically, it's effective. So why is it effective? Based on the actual components of the plants, and also obviously you chew it to get the bristles, and the way that you utilize it, they have found that it has all these benefits: anti-inflammatory, antibacterial, which there's a lot of bacteria in our mouth that needs to be removed, especially when we wake up in the morning, when we eat, antiviral, antifungal, anti-carcinogenic, which means it would prevent cavities because of all this stuff. Anti-plaque, which means that this soft, mushy stuff on your teeth that forms after you eat and everything, it can get rid of it. And antioxidant as well. So not all of these have been well developed and studied very detailed, but the one particular study I read went through each category and kind of talked about what makes it anti-inflammatory, what makes it antibacterial. And there's so many different components it has that help it. And so, like I said, with those bristles, you're trying to do what I showed you earlier. I showed you the picture of the toothbrush and how they did all this angles and everything. But with the chewing stick, because of the way the stick is and the bristles are at the end, you can actually just remove all those tartar and buildup. And because of that, and the nature of the bristles, much like our toothbrush, but these bristles are a little bit different. It can help to actually remove stains, because staining, unless the stain has gone deep in the tooth, a lot of staining from like drinks and things like that can actually be kind of brushed off. So it helps with that. And then it had a whole list of things. Provides an enamel barrier, which is the layer, the outside of the tooth. increases salivary flow. For some reason, when you use the chewing stick, you have more saliva. You salivate, and that's actually really good because more saliva is always good in your mouth. You always want more saliva, not less, because it lubricates the tooth. It helps to keep the tooth remineralized and healthy, and it flushes off things off the tooth. So you salivate when you use it, and it eliminates bad odor. So it actually has a lot of benefits, which I didn't even know it had all these benefits. So I don't know, people can kind of dialogue on that. I don't know how many of people are using this still here or even back home, but it is beneficial. Even if it was something that you use your toothbrush, you do your twice a day, and then from time to time you use this. It's also helpful. So basically, what they found was that there was parallel and at times even greater mechanical and chemical cleansing of oral tissues as compared to a toothbrush. So it's actually very, very helpful. And versus the manual toothbrush is the traditional oral hygiene aid. And still, I still stress that you should be using this. And of course, these days we have manual toothbrush. We also have electric toothbrushes as well, which I always encourage patients, if it's possible for them, to get electric toothbrush, because what that does is it spins and it kind of helps to cleanse your teeth more than just your own manual usage. And when you use an electric toothbrush, I still encourage patients to still do the circular motion, even though the toothbrush is moving. So I recommend that the toothbrush still, but the chewing stick is a great, great option as well, in addition to the toothbrush. And this was the final conclusion. It had very, very good results. It was equally effective in terms of gingival status, and in some cases, reduction of plaque scores were even better. So less plaque, which is the buildup on your teeth after you eat. So I also want to mention charcoal powder. I don't have as much information, but from my understanding, this is also something that's being utilized on is it plantain? Like, I forget what I was told how people do it, but something with plantain, outside of plantain, they use it to clean their teeth. So nowadays, actually, even here in America and a lot of places, there are many toothpastes with activated charcoal, and they're marketed to aid in whitening. They were actually first reported in use in ancient Greece. So it's funny because both the chewing stick and charcoal are ancient oral hygiene. It's like now that we have this modern day stuff, but this is what people were using back in the day. We've also seen that it's used as quote unquote antidote for medical treatments, because I believe it absorbs toxins. So if you have a stomach bug, to take out that, or sometimes if someone has consumed actual poison or something, like they'll take charcoal. I know people drink charcoal back home for different reasons, but it can help in that way. So, but what we see dentally is that it can attach to enamel and remove tooth coloring agents. So it can whiten your teeth through abrasion because there's particles, and it can actually abrade your teeth. But overall, charcoal has been, when they compared it to traditional whitening in terms of like, hey, you just want your teeth to be whiter, it wasn't as effective as the other agents we have. But we have some agents now we have called carbamide peroxide that they put when you buy a toothpaste that says whitening toothpaste, or you go somewhere and get your teeth whitened. It's usually more effective than the charcoal. But the problem with charcoal is that it can actually abrade your tooth too much. So like I said, it has those particles. So it's like kind of cleansing your tooth. But what they're finding is that sometimes it kind of wears off the tooth a little bit too much. So I would say with charcoal, it can be more of something you do less commonly or less often, because it has that characteristic where it can actually abrade your tooth too much. So with the chewing stick, definitely all for that. The charcoal is not as helpful as it has been marketed to. And another thing that I didn't even include here on my study, but baking soda is something people use also, which is like a powder to help. But I think with baking soda, it's going to be a little bit better than charcoal because it's not as abrasive over time. So if you're looking for something that has that grit, that kind of like helps you feel like you scrubbed your teeth, baking soda from time to time. But of course, when you see a dentist, we have something we use that has a grit in it to polish your teeth. And that's actually the best because that's been studied and found to really, really help cleanse your teeth and whiten it. So that's the best. So charcoal, overall conclusion is it's okay, but it can be a little bit too abrasive on your teeth. The last thing I'll talk about is untreated dental decay, because it is specific to this population. because if people are not seeing the dentist, if the dentist is not a low priority, something like this could be going on. And unless it was this big in your mouth and you have pain or you notice a hole, you might not know. Sometimes there's no hole. Sometimes the cavity is inside the tooth in such a way that a dentist has to actually open it up we open up the decay and we see the hole. So the only way to detect that would be on X-ray. So what am I talking about? So when I say dental decay, I'm talking about a hole in your tooth that is formed because bacteria is in your mouth, and there's sugar in your mouth from whatever you're eating, and the bacteria consume the sugar and produce a byproduct that breaks down your tooth. So what ends up happening is it can start off in the very outside of your teeth, and then it can go deeper, and and once it gets to the inside, it gets to the part of your tooth where there's a nerve. Every single tooth has a nerve, and there's blood vessels and nerve there. That's when you feel, there's pain. Like I eat something and it's so painful. I eat something cold and it's so painful. Most of us, when we drink cold drinks or hot drinks, we feel something. That's normal. That just shows that your teeth are vital and there's a nerve. But if you feel something and it's like very painful, that's not normal. And that's most of the time there's untreated dental decay. There's a cavity that has gone into your nerve. And at that point, we're talking about a toothache and we're talking about infection, because it travels through and it can come out, and basically it produces infection, and it has to go somewhere. So it's just multiplying, right? The bacteria and the pus and everything is multiplying. That's when you see someone with their whole jaw is swollen, like from one tooth. That just means that the infection is spreading. It's going into different spaces. Sometimes it's just a swelling on the gums, but it always starts small. It starts at one level and it works its way out. So this is common in populations with less access to oral health clinics, including many regions in Ghana, like I mentioned. It's actually the most prevalent condition worldwide, and it can negatively impact your life and your overall health. How? Because, like I said, you can end up with pain, swelling, infection. It depends on where it is on your tooth, but you can notice one day, oh, my tooth broke. Why did my tooth break? It could be a variety of reasons, but it could be this. And so this is another reason why it's important to see a dentist, because we can catch it very early, where it's just at the surface. And at that point, it's very easy to treat it. You just clean it a little bit, fill it. Or maybe it's gone a little deeper, but it's not too deep. When it gets to that level where it's so deep, it's in your nerve, at that point, you're going to need something more invasive. Like you might need a tooth pulled out completely, or you might need a root canal. So prevention is really what's going to be important here. The other thing I want to mention is that, and I didn't make a slide on this, but we as Ghanaians, sometimes we chew on things that are hard, like bones. I know a lot of Africans do that. And that's not good, because in general, you can break teeth. Even just good teeth that are fine, you can break teeth. But if you have untreated dental decay, say there's a cavity going on somewhere, you don't even know about it, you can be like, oh, I just bit on it. I didn't even bite that hard. And all of a sudden your tooth breaks. You're like, oh, why did my tooth break? Well, there's something was going on underneath sometimes that we didn't even know about underlying. I've had so many patients, I ate this and my tooth broke. I ate this and my tooth broke. And I'm like, most likely there's something underlying untreated going on, and your tooth was weakened. Because God designed our teeth to take on a certain amount of force and a certain amount of pressure, but they can only take so much, especially if they are compromised. So that's untreated dental decay. And it's just, I say all that to say that I encourage every one of you to try to establish care with a dentist, and also educate friends and family members as well on this. And so that's actually the bulk of my presentation. I just had a little select topics. I could go into more detail on specifics, but that is just the select topics that I wanted to go over and kind of educate on. If you have any questions for me, or you would like to reach out for any reason related to what I spoke about, I have my email here. I also have my Instagram if you would like to go there as well. And you can also message me on there. So that's my presentation. And I guess now we will open it up for questions.
All right. Thank you so much. I've been sitting here and I've been listening. I'm like, okay. Oh, I'm part of that. Okay. That's me. Okay. Oh, that's me right there.
Yeah.
I've been checking all the boxes.
Yeah, we all do it.
Yeah. So I'm just gonna go step by step. We talked about flossing, right?
Yes.
So and we talked about different types of materials that we use to floss. People use that, the string.
Mm-hmm.
Also use I don't know, like something like a steak or something. And, I mean, how effective is all those things?
Yeah, there's a lot of different ones. I would say the best one is just a traditional string.
Okay.
But there's other ways they've tried to make it convenient. There's one where the string is on a small thing that you can hold it and just floss it. That's also good. Are you talking about toothpick also?
Toothpick also, yeah.
So toothpicks are mixed because toothpick, a lot of times the way that we utilize toothpick, it can sometimes basically poke at and irritate the gums. So if like let's say food is stuck in your teeth, I would encourage you to use floss first, a regular traditional floss that you use, because toothpicks, even though we commonly use toothpicks, they tend to, because of how sharp they are, they tend to actually irritate the gums. At least that's how it was presented in dental school. We don't really encourage toothpicks, but obviously it's a case by case thing. Like if you ate some meats and it's like stuck so bad and you can't get the floss into it, and you can get a toothpick, yeah, that's also okay. But I encourage that. And then the other thing they have now on the market is what's called a water pick. So a water pick is an appliance, not an appliance, but it's a little, it looks like electric toothbrush because you charge it and it's like a whole thing and it shoots water through your teeth. It's mainly made for convenience. I feel like it's supposed to be an easier way of flossing. And water pick is also good. It's also something that we recommend. But number one would just be regular floss, and it's way cheaper than the water pick. But I've had a lot of patients who's like, oh, I have a water pick. I use that all the time. I'm like, yeah, it's also really good. It basically pushes water with force to push anything out of your teeth. So that's also a very good option.
All right, my next question will be about brushing. You mentioned how to brush and stuff like that. But when we were growing up, right, we were told that the harder you brush, the better you get the germs off your teeth. How true is that?
Not true. Well, true in a way, but not completely true.
And also, the second part to the question is, the brush, how strong does it have to be? Because we Africans, they want it to be that hard. They want it even extra hard,
Yeah, we Africans, I realized that within my own home. I had to teach my my mom and stuff and some people about. So basically, we as Africans, we tend to want the hardest toothbrush and brush so hard and brush so hard. But what happens is when the toothbrush is hard and you're brushing with a lot of pressure, you cause toothbrush trauma. That's what it's called. And you make your gums recede. And the gums, you actually start to break down the gums at the edge of them because it's too much pressure. So with brushing, what you really want is you actually want a medium, because now they have different, medium, soft, medium, and hard. You don't want hard. Don't ever buy a hard toothbrush. You want soft or medium, and it's more about the technique and light pressure than it is doing a lot of pressure. But a lot of pressure is just, like I said, it can traumatize the tissue. But medium or soft, and are you going at the right angles? Are you doing circles? Are you getting every surface? That's the biggest thing. And that's why now the electric toothbrushes, most of them have a light that lights up when you're brushing too hard. And even me, I have one because obviously I'm into dentistry. I have an electric toothbrush, and it's like it lights up a lot. I'm like, I'm brushing too hard. I'm like, so basically, it's saying that you don't need to put a lot of pressure. You just need just enough pressure that the bristles are touching the tooth, and getting the surface. It doesn't have to be like so that when you finish using it, your toothbrush is just frayed every time. And like you should be able to use a toothbrush for a little while, a couple months without it being so destroyed because you're brushing so hard. Which you should change them out every like 2 to 3 months, actually.
Okay. Well, let's talk about the studies that you just you did they did in Ghana, and their conclusions. And I was sitting here, I'm like, okay, this I stayed in Ghana for a while, for a very long time, and I use a chewing stick that you talked about. I use that body tray, as we call it, and the charcoal and all those things. I've used them before, and because back then, toothbrush at that time was who had a toothbrush?
I heard this the same thing.
Yeah, so we use the charcoal and that body tray and all those things, and in a way, it helped us back then. But I'm looking at that 89% of people I mean the clinics. I mean, truth be told, I mean I've not been to Ghana in a long time, but when I was there, I didn't even think that I saw a dental clinic
At all.
at all. I mean,
Wow.
maybe I didn't pay attention or I just
Yeah.
didn't look for it. I mean, I did not even see one.
Yeah.
So the 5.5% that you're talking about is actually true.
Yeah.
It is really true because a lot of people and we really don't even care about dental health.
Yeah. And
Just
I think that. Oh, sorry. What did you say?
yeah, go ahead.
Yeah, I think that it's not bad. It's just what has been the precedent, the norm. That has been the norm, and I think that a lot of people who are learning more about dentistry or becoming dentists back home, because we have a dental school back home, they are producing dentists and they're starting to open more clinics and stuff. It's like now we're trying to shift it, but it's hard. And even when we come here, it's like people are talking about, oh, we go to dentists twice a year, and people are like, oh, why? Do you have a problem? I think that's kind of what the norm has been. For you growing up, did you know? Did you? I guess you didn't go to dentists, but anyone in your family have an issue or need to go or ever
Mm.
any talk of dentists?
The whole point is if you had an issue with your teeth, we just do use traditional you know how Ghanaians will like self-medicating,
Yeah,
so they will just do something to it and for some reason it will go away
yeah.
without even thinking of going to see a dentist.
Yeah, and the other thing I should say is that Ghanaians take very good care of their teeth because if ever I've had opportunity to look in a Ghanaian's mouth, our mouths don't look like Americans because Americans eat so much sugar and they let their kids eat so much sugar and they get so many cavities even from a young age. But we usually don't consume that much processed sugar, and even if all we have is a chewing stick, we do a good job cleaning it because we're good with that. So that's the good thing. And like you said, people will turn to traditional medicine, but those issues are still there and sometimes untreated. And sometimes the traditional medicine medicated and it didn't solve it, and it's still there. Later on, it will flare up because some things kind of lie dormant in your mouth. Like you don't feel anything, and then later on, you feel something.
Yeah, so I'm gonna share my personal experience with you. Before until you came on this show, I've never seen a dentist.
Really?
Yeah, and I'm quite a little, I'm up there in my 30s. So until you you
So
came on this
I
show,
convinced you.
yeah, pretty much.
Good.
That means you did a good job.
Yeah.
So I went to see my dentist, and then she asked me, "Oh, who's your dentist?" I'm like, you are?" And she's like,
Yeah.
"When was the last time you saw a dentist?" I'm like, this is the first time. And she's like, "What?
Yep.
How is that even possible?" I'm like, "Well,
Yeah. In America, people usually go. Yeah.
yeah." So she did all these tests, and she was really surprised though because she said, "First of all, you've never seen a dentist, and you don't have a cavity, so that is strange." She called all the other dentists, and they were like, this guy's ridiculous. He went to he's never had a dental work,
Yeah.
and he doesn't have cavity. He doesn't have no teeth problem. This is strange.
Yeah.
So this brings me back to my point that Ghanaians, right?
Mhm.
Even though they don't like seeing dentists and stuff like that, is it also possible that we take better care of our dental health?
I would say yes. I would say yes because even in some churches I've been in, I've done some Ghanaian churches. I've done some programs where I've been examining people's teeth, and I've seen a lot of Ghanaian teeth, and I've seen a lot of people from here, and even just recently had a patient from Cameroon. Same thing. I've never seen a dentist. Basically nothing going on. And you see some people who are going every 6 months, and they have so much going on. So we take very good care of our teeth, and I think we also don't consume as much processed sugar. I could be wrong, but I don't think we grew up drinking soda the way some of these kids
No,
they
no. I
drink
mean, soda
soda.
was very expensive at that time. You can't even buy it.
Buy it, yeah. And then some of these kids are like drinking Coke every dinner, every day, and stuff like that. So I think that we take care of it as far as what we consume, and I think that if whether we have a toothbrush or a chewing stick, we're meticulous with how we clean. I think that we do very well with that. So, even though some people, there are some untreated issues, for the most part, generally speaking, we are taking very good care of our teeth and probably not having as much issues. But then it depends though, because as you age, sometimes certain things start to, just like with your body, things got to break down. So like you finally went, at least you went, you're young, but like, let's say you never went and you were like getting a little bit older, we may expect to see some more issues at that point, especially that's what I've seen is like more elderly Ghanaians who are like, my lifetime, I haven't really gone. That's when I'm starting to see quite a few more maybe broken teeth and things like that, just because of how long it's been.
Yeah, I think that you also impressed Dr. Fori too, because he's also saying that he learned to brush his teeth better.
Good.
Yeah. So it kind of the way you look at it, I think it's pretty much personal though. Like for me, now I go. Once I started going, I've not stopped. Right, so I keep going. So I encourage everyone to go.
And did you have a positive experience? Because I know some people go and then they feel like their teeth are sensitive or something after that.
Well, I mean, honest to you, I did not feel anything. Like I didn't see any change. Like there's some people that go like, oh, the dentist broke my teeth and stuff like that. Oh, I started having problems and stuff like that. But for me, no. I mean, I'm not even no changes. I mean, nothing.
Good.
Yeah, and that brings me to my next question, though. We see a lot of people with white teeth, very nice teeth and stuff like that. But then once they begin to talk, you begin to move away. Why is that?
Like they have their bad breath.
That's right.
Yeah. There's a few reasons for bad breath. One of the biggest reasons would be gum disease or periodontal disease, which you wouldn't really know that you have that unless a dentist diagnosed it, or maybe when you floss your brush, you see bleeding. But basically, what happens over time, depending on what you eat, depending on the way you brush, or do you floss or not, and also your overall health. Like if you're diabetic, you're more likely. You may have periodontal disease, and periodontal disease has an odor. I know because I encounter it like every day at work. So some patients will, obviously I wear a mask, right? Most patients, I don't smell anything. Some patients, I can be wearing a mask and the smell hits my face, and it's like I immediately know we call it perio. Like, okay, that's perio right there. And it's just the kind of bacteria that it's a different bacteria, and also you see that if you go to one of my pictures where I showed the before and after with the prevention, you see there's some buildup of plaque and calculus, which is like a hardened material, and it smells. That smell is bad, and you might not see it that well when they smile. So you're like, oh, they have a nice smile. That one, yeah. Oh, they have a nice smile, but you can't see that behind it. It's like if you look along where the gums are, you see something that's more like a layer there that's hardened, and so that person probably needs a deep cleaning, and has to get all of that off. That's what they did, and you see the after picture. But bad breath is mostly perio, or some people because of their habits like smoking, things like that. Especially smokers have bad breath. And then there's just a condition called halitosis, which is bad breath, and it's like it can be linked to some other conditions, like maybe your oral health is okay, but there's some other underlying conditions that cause that, and then we can treat that with a mouth rinse.
All right, let's go back to Facebook and read some of the comments. Akwesili says, welcome. Yeah, welcome back. And also, Dr. Fori had a question when you were talking about, Ghana. His question was, what was the general oral health of Ghanaians, in the study that you guys did? Are there a lot of dental issues reported, like, when they conducted the studies? Did they encounter a lot of other problems with dental health in Ghana?
Yeah, I mean, the whole thing was that in general the oral health is good, like we mentioned. In general, we do, if you compare us to other populations, we are doing well with what we have. But then we did see that there were specific issues like untreated cavities, that maybe some back tooth somewhere has a little hole on it. You don't know what it is. You don't even feel it, but it's a cavity that has been forming because over time it has progressed. things like that, and untreated gum disease also, where you're basically doing what you can, but you're not cleaning deep enough, and there's still some of that bacteria going into the gum. So there was 3 things they mentioned, which was cavities, gum disease, and then retained root tips. Which what that means is like if for some reason a tooth broke and in your mind it just broke, most of it broke off, but still under the gums there's still more of the tooth there that it actually just needs the rest of it needs to be removed completely. Some people had that problem.
All right. So you're saying that generally, Ghanaians have if not good, but we will say, they're okay with dental health, right?
Yes, overall.
Overall, okay. And Dr. Ford also was saying that he says he believes that we can start in schools, and when you're talking about creating that awareness, with dental health in the Ghanaian population. So he was saying that we can start with schools and other things and create that awareness.
This is very true because it really starts young, and maybe for adults, it's like if you're kind of set, you've already done things a certain way. But if we can start with kids, that would be great. And yeah, it's something that I'm interested in. But even me personally, I'm like, where would I start? With that, I'm not even there right now. But it's something that I mean, I have other Ghanaian dentists, mostly people who are practicing here in the U.S. that I talk to, and it's something that we can all be seeing what we can do to kind of start a program back home or help partner with dentists who are already there, and they have hygienist dentists who are already there, and see if these are things we can start. Because you're right, starting with the kids will be great.
Starting from schools. Yeah, and there's this question from Akwasi Nimo. He's asking how much dental implant costs.
Dental implants are very expensive.
Yeah.
I can't even really explain to you why. I can give you a range, but it's going to depend on your office and if they have insurance coverage. But a dental implant from start to finish with the crown, it's typically a few thousand. It's typically anywhere from like $3,000 to $5,000, and it depends on the insurance. I'm not even that good with insurance. It's something I'm learning more about. They may cover a little bit, but it's not one of those things they cover a lot of. There's other procedures that they'll cover a lot of, but that's one that usually people have to do like a payment plan or save up. But it's expensive. They're definitely not cheap. They're the way of the future, and a lot of people are doing them. They're figuring out different ways to finance them. But basically, the dental implant is if you're missing a tooth, it will replace it like from start to finish. It replaces it as a single tooth. So especially people who have had trauma and they break a front tooth and that tooth is gone, and they just want something that will be there. You don't have to remove it. It doesn't come out. It's fixed in your mouth. Or something happens with one of your back teeth and have a toothache, they have to remove it. And instead of having to do like something else and have this gap, people do implants. So
Yeah. So my next question is why is it that expensive? Why?
I would say because of the procedure itself. It's a very, very skilled procedure that involves a lot of instruments, and I guess just the precision that it takes to do it. So the actual procedure is that it's like almost like a screw that they're drilling into your bone. So it's like it's a surgery. They have to like cut the gum. Sometimes they go through the gums. They have to like make an incision, flap it out. I say they because I'm not trained to do implants. I would have to do additional training. But I'm familiar with the procedure. They have to open the gums up, make certain type of hole in the gums. Make sure it's angled just right because you have all these other roots for adjacent to. Make sure it's angled just right. Sometimes you do a lot of planning before you have to take a certain CBCT scan to plan and see how their bone is, and it's kind of involved. That's why I guess that's why it has that cost as compared to some of the other things we do in dentistry. Like a filling is going to be like $200, which is still a lot of money, but it's not a lot. But a filling is something I just do quickly, and certain things like that. But the more skilled the procedure, the more it costs. Also, implant is multiple appointments. Like you place it, they come back, check the healing. You come back again to start the crown, to finish the crown. So it's so many appointments. So in dentistry, we use the phrase chair time. Like chair time is money. So the more time you're in my chair and I'm working on you, the more that we try to collect on that procedure. So yeah.
Well, let's answer this question before we move on. Dr. Forrest says he says he's no, this is technical, but he's asking why the tooth doesn't grow back when you get older. Like, if you're a kid, it grows back, but once you get to a certain age, it doesn't grow back anymore. Why is that?
Um, it's because we really just have two sets. We have the primary set and the adult sets. The adult sets. So when you're a child, starting at 6 months, like my son is 9 months, as he has two teeth. Starting at 6 months, you begin that process of your primary teeth erupting. So from your childhood up to maybe around age 3, you're a toddler, you'll have 20 teeth as a toddler, 3-year-old, 5-4, 5-year-old, 20 teeth. Then when you're about 5, 6, you start to get the next set, and then those all slowly come off up until age 12, like one by one, and they get replaced. And once you're around 12, you have actually 28 teeth. When you're around 17, you get 32 teeth. That's when you get wisdom teeth, 32, and that's it. We have not been designed for another set to come back in. It's just those two sets. So if anything happens to those teeth from your adolescence onward, they break, they come out. That's it. There's nothing else to replace them. That's why we're trying to play God now and be God and create teeth. So we have implants and we have bridges and partials and different options for replacing a tooth if it's missing. And also, some people might say, why are we even replacing teeth? Like, if it's gone, just let it be gone. But when you lose a tooth, so many things happen. It does affect your chewing because all of a sudden there's a gap, but also teeth are dynamic. So our teeth are in this particular orientation because that's what works in our mouth. When you take one out, the one next to it might move in, or the one above it might come down very, very slowly and gradually. So it is good to replace them so everything can stay in its right place and so that you still have the function that you need. But yeah, basically the teeth doesn't grow back because there's nothing else there. There's no more teeth, just the two sets.
All right. Also, I told Kwame and I also says, good job, guys, and greetings to your guests. Yes, I told it's greeting you.
Greetings.
And he also said he learned to floss after seeing a dentist. Yeah.
Yeah, we try to tell our patients.
Yeah, Ghanaians, we don't, if you've not seen a dentist, I don't think you'll be doing that. Yeah. So my next question, we're going back to the presentation. You talked about bones, right? We Ghanaians, we love our bones. And when I was growing up, they would tell you that chewing a bone will make your teeth strong. They go ahead by saying that the bone contains calcium that makes your teeth strong and stuff like that. I don't know how true that is. So can you please explain to me why chewing a bone is not good, like you mentioned?
Chewing a bone, I mean, overall, it's not good because of the hardness of it. Now, obviously, it's not so hard that we can't chew it. Like our teeth are able to chew it, but especially when you don't know if there's a underlying untreated decay that you don't know about in your mouth cavity, and then you chew one bone just the right way and it breaks it. So I've heard those stories, people chewing bones from time to time, and because of that issue, you could have a tooth break. That's why I say let's stick to like other foods that are softer to chew. But this idea that it makes your teeth stronger is not necessarily true because, like I said, it's really just putting excessive pressure on the teeth and it can break them. I think maybe what they're talking about is the contents, the contents of the marrow that maybe once digested can help strengthen bones. But actual pressure in your teeth is not helpful. It can actually break teeth. So, and some people's teeth are stronger than others in a sense because it's a lot of it is genetic. Even though we all have enamel, dentin, and all these teeth, the layers to the teeth, some people are stronger. You'll notice some people have very long teeth. When they smile, you see so much teeth. Some people when they smile, you just see like their teeth are small and like brittle. So some people really should not be, but chewing bones at all. So because you don't even know what type of tooth you have, just to be careful. Obviously, if it's a habit, it's hard to break habits, but generally speaking,
we love our bones, eating food without bones. Yeah. We don't choose soft meat. We like, bones.
Yeah.
Yeah.
If possible, I say try not to, but it's hard to break that habit. And I mean, a lot of people here have a habit of chewing ice. That's their version of it. And you would think to yourself, oh, ice isn't that bad because it's just, it's water that's hardened. But same thing. People will come and be like, oh, I broke my tooth, I was chewing ice. So that's why I'm like, let's cut out these hard things completely and just try to stick to like softer things, because it can also put a lot of pressure on your jaw joint when you chew hard things.
Okay, so we're just gonna open the phone lines. So if anyone has a question, that if they are not on Facebook and they want to ask a question, they can call in and then ask. The number is 773-937-1425, as it is on your screen. So you can call and then ask your questions, or you can also send them on Facebook. You can send them on YouTube. If you're watching us on YouTube, we can send all those questions over there, and then we can, answer all those questions for you. So we're going for a quick commercial break. I know it's been a long time, so we're going to give you some time to drink some water, and then when we come back, we have more questions for you, and then we'll try to end the show by you're in Texas, so by 11:30, so you can have some time.
Yes.
And I hope that is okay.
Yes, that will be good.
All right, so we're going for a quick commercial break, and then when we come back, we continue.
Miniaba, any mammy do see, or yet more do see, and no pebiera minia bell, sorry, I'm what dimu, no quadrum, on complaining that, tell whom to know. Sansuna me bra, we fit any, go to engine, no pejanting, the card you must say this city, that be bierano, and what in dending, Miamere, or store, no dinja, me yet, and sorry, no pa, and cassen and near her, and I said, no, we are murder. Salam papa, Nymphia conkind, or no soon complaining that, tell whom be any ya, or sorry, no pana, no fancy kind, or conefu, me, acrobato, Majuma me, me can news, na me acti, na me come back, ebra me de bedampo na adias nanso men sorry da krokran ka se me hu ba bia me ya ni nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ni nyina ni kowa mesha kurani eyaduru a onomu a ebo ni padua no ema wo se pi usita me kanfo ama wo se wonso no no kowa mesha ni bi na ba boa na aboa no abusua na yare da ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876-891 and at 0547-641-310. Se wo pe kwa mixture ato ewa America abrochi memu called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadie nkratuo yi agiatum se eye.
Just one more pic, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT1179663.
World Remit, a better way to send money. Download the app or visit worldremit.com.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, yes, I am Akwaba Eba Ako Radio. So I feel now do a feeling at home. Health and wellness now to go so with you. And then you can dental health. Dental health and what's something you can if I send a new in general. I can't be fast a bit to make it clean. I have my problems because your doctor or church or part of us say was no. So be a big boo and I be our situa. O kasa across or self-confidence across the the way I was sitting can cry and across the sun. And I don't want some can. Now I believe so your first caller I will line so. And see about picking na yamano akwaba na video on so okay. The Akwaba radio.
Media so
Ajaba, net design.
I will go to here when I'm well.
Nyame adom boko.
With a money at my daughter so abaso. Now more question could do. I say was one replace here. A war impact be also later in your life, and I say it's not a bit teaching.
Okay, all right. Nebuama, what we are normal. It does so afraid. I therefore also bet me a friend. I also a question be also so the aba. Now doctor also so we are normal. Dr. Octchere.
Yes.
Yeah. So his question was, in case you take out your tooth, right, and you don't replace it, or you don't do an implant or something like that, does it have like any impact on you? Maybe down the line?
Yeah, it can have an impact. As I mentioned, basically each tooth has a place structurally in your mouth, and it holds its position. So when it comes out, the teeth next to it, they basically react to that. They realize that there's no longer something sitting next to them, and so the two teeth next to it, because there's probably one in front and behind, unless it's the last one. If it's the last one, it only has one. But if it has two teeth and you remove one tooth, they can move in to that spot a little bit over time, or the tooth that's above it before when you chew it would hit, now it can come down. Or if it's the very last tooth in your mouth that comes out, usually that one doesn't have too much issues like as far as teeth moving. It's more so when they're between teeth, the other teeth can move. And the problem is if they move enough, then it's going to be hard to replace it in the future. You can't replace it. Like later on, if you're like, oh, I wanted to replace this, you can't. Or you would need like braces first to move them. Because once they move, you can't move teeth. The only way to move teeth is braces. The whole thing is when there's something missing when you're eating, you know that there's something not there. Like whereas before, like let's say you're eating something hard, like eating nuts, the nuts will go to the other tooth. It can go to the hole, like not the hole, but the gap, and touch your gums. Certain foods, I know patients will tell me something like chips, like if you're eating chips or something like certain foods that are harder will go to that place and maybe like poke it because now it's just gums there. Or usually, when you eat certain foods, it has its way of moving through your teeth and then going to the throat, but because of that gap, it may come through. So when you lose one tooth, maybe you won't. It's not going to be so apparent, but especially over time, if you lose multiple, that's when you'll start to notice. And the biggest thing is that teeth can shift, and it's something that cannot be shifted back unless you do braces, and it can cause issues when they shift, and then you can't replace them or anything after that.
And I think I'm not an expert though, but I can also say that it depends on where the teeth is.
Yes.
That can also affect, the way you behave.
Yes.
If it's this one right here, well, you might have to replace it because, sometimes it even affect the way you talk, your self-confidence and all those things. So, yeah.
Yes, because if it's in the front, it's usually critical. Patients would most of the time try to replace it somehow. And like I said, implant is not the only option. There are cheaper options. There's actually a few options, and the prices go down. So implant's just the top of the line. And yeah, when it shows when you smile, most of the time people are trying to replace it quickly, and those are the kind of things that will bring people into the dentist and be like, okay, I need a solution because I don't want to walk around like this. COVID helped people because of the masks. So people who have those problems were hiding with the mask, but not everybody wears masks anymore. It won't always be a thing. So,
yeah. Dr. Ford also has a question. He says, I've seen people use a scraping tool on their tongue. Can you comment on the effects this one has? Like people use scraping tool to scrape their tongue. Yeah. Can you comment on that?
Tongue scraper is actually very good because our tongues, just like our teeth, also collects bacteria, food. It can actually get so bad that some people's tongue looks kind of brownish. It could actually be that, depending on what they're eating. So they sell tongue scrapers, same place you buy toothbrush, toothpaste, and tongue scraper is good. But with anything, you want to use moderate pressure. If you're using a tongue scraper and you're really scraping your tongue hard, then you're going to be damaging the tissue over time. And that's a critical area because you have your taste buds and all of that. But overall, I encourage tongue scraper. It's not something that I put in my presentations because it's not a requirement. It's just a supplement to help clean your tongue. Aside from the tongue scraper, you can use your toothbrush to brush your tongue. And it's actually probably a little bit more gentle. You don't have to worry about buying another product. But tongue scraper is good to have as well if you want to just have that extra clean way to clean your tongue.
Okay. Someone is also asking, Mohammed is asking, does moringa stop mouth odor? I don't know if you know moringa.
I don't actually. I was about to ask you, what's moringa?
Well, Mohammed, this is not a Ghanaian-based doctor, so she doesn't really know what moringa.
Yeah,
I think it's a leaf that they process, and then they drink it. I believe so. Mohammed, if you have more explanation, I've heard about moringa, but actually I've never seen one before. I've seen it on commercials and stuff like that. They say if you drink it, it makes your mouth, it helps you, but I don't know. So,
okay. This is something I can add to my presentation for the future because anything like that, I want to discuss those topics. So I have to do some research.
Yeah, please dig into it. Next time we call on you, we expect you to have some idea about moringa and then how whether it helps with mouth odor or not. Yeah, Mohammed, we'll get back to you on that.
I'll get back to you.
So and I think we also had a Ghanaian dentist on the show. He came in all the way from Ghana. So and he talked about I think different kinds. There are different practices over here, and then different practices over there in Ghana. Because of the culture and other things. So some of these things they might know more about it than some of us here. And then he was saying that people. Let me go to this first. It says there's astral snuff in Ghana that they chew instead of sniffing. They claim it treats.
Yeah, that's what it is.
Other stuff here. Yeah, we might have to bring. I think. One dentist. Yeah, we might have to bring him to explain all this stuff.
Yeah.
But can you take a shot at this one?
They claim that it treats toothache. I don't even know what this is. The thing about a toothache is there's a lot of things, natural remedies for toothaches, like menthol, and there's so many things even here people can use. But the problem is that the issue will need to be addressed by a dentist because if you're having a toothache, that means it's gone deep into your tooth. So anything you use to medicate will just be temporary. So I still recommend if you have a toothache, like your tooth is paining you so bad, try to establish care with a dentist if at all possible, because that's where you're going to get the actual resolution of the problem.
Yeah, Mohammed again came back saying that people eat before they brush their teeth. Some people, I know a lot of people, not I wouldn't say a lot of people, but I know people who actually do it. Like, in the morning they don't brush their teeth, they eat before they brush their teeth. Is it okay?
Yeah, so actually, the opposite is better. It's better to brush first, and the only reason is because so when you if you were to eat first, when you eat, your teeth are exposed to a lot of different chemical components in the food, but a lot of foods have acid, different types of acidic products. And when that's on the teeth and you brush, and like let's say you eat and then you brush right away, you can actually damage your tooth. Like when I say damage, I'm talking about just very, very small abrasion. So the best thing actually is to brush your teeth when you wake up and then eat. Because if you, let's say you went ate something like lemon, drink lemon water, or eat like oranges or and something else that has some acid in it, then you brush your teeth, it just causes erosion to the teeth. So the best thing is just to make that the habit. And I know some people don't like it because they rather like eat than brush, but the best thing is for there to be 30 minutes between eating and brushing, basically. So to make it easier, you don't have to think about that. You just brush first.
So yeah, that was going to be my next question. Like, how long do you have to wait before you brush your teeth? And
Yeah.
you said it's 30 minutes, right? At least.
Ideally 30 minutes, because I know some people will like, oh, they like to eat brush after every meal. And so like, oh, I'm gonna eat lunch and brush. I eat and I don't brush. But you need to wait at least 30 minutes. And so that's why the recommendation is just brush morning when you wake up, and then in the evening before you go to bed. You probably don't eat and then immediately go to bed. So there's been at least 30 minutes since you've eaten, and you brush and you go to bed.
So rinsing your mouth. Does it also is it also considered kind of brushing, because people do a thorough rinsing, and they think because they've done that, they're okay. Is that okay?
Well, the rinsing is helpful because it does cleanse your mouth in a way, and it does um, reduce the amount of bacteria and help cleanse. But it doesn't take the place of brushing or flossing. It has to be a supplement. And so because it doesn't have any mechanical we say brushing is mechanical because it's physically mechanically removing something. Mouthwash does not do that. So I've heard of people didn't want to brush tonight, so I just rinsed, but that's still not good. You have to brush still, because the rinse only kind of cleanses it. It doesn't really clean as deeply as you need clean, because food is stuck to your teeth. It's not going to get it off.
Yeah, I think Mohammed was talking about hard brushes, but we had already discussed that. So yeah, so and you mentioned that it's not the hardness, but the technique, right?
Yeah, it's more so the technique, and preferably a softer or medium tooth brush, not the hard. I don't even know why they market the hard ones anymore, because we found that they're a little bit damaging. So.
But in Ghana, though, I mean, pretty much everywhere you go, they have the hard ones. So is that cultural or?
I think it's cultural, because I think culturally we like to feel like we really brush, it's clean, but it's better to use my medium. So hopefully these days they have more of those also available.
U.S. market, you really don't see that much. Most of the ones that you see are pretty much the soft or the medium one. The hard ones, they're not even hard compared to the ones that they have in Ghana. Like it will scrape your skin off.
Exactly, and we use that on our teeth. That's why the gums end up, yeah.
And Dr. Fred was, talking about the moringa, and he's saying it's a herbal product. So maybe we can look into it.
Yeah, I'll look into that.
So we're not going to take much of your time. I think it's 11:24 right now, and then we will just have you conclude this for us. But then we want you to give us your last words on our dental health.
Okay. Sure. So thank you so much for having me again. I appreciate it. My final words are: dental health is so important. And even if it hasn't been a priority for you historically, because as we mentioned, it's not that we as Ghanaians purposely have not prioritized it, it's just the norm. And so even if that has been the norm for you, now that you've heard my presentation, allow this to, just like Kwame, allow this to inspire you to now set up an appointment if you can with a local dentist, whether you're here or back home. Just try to establish care. Twice a year is the best, but even if you go once a year, it's still something, and it's not that often. So I just want to leave you with that. Dentistry and dental oral health are very, very important for your overall life, and you should prioritize it just like you prioritize everything else. And if you have any questions, feel free to reach out to me.
Before you go, Mohammed also came in. Oh, I think that was the same one that we did. So we're going to thank you so much for coming, and my regards to Dr. Octchere and the two kids.
Thank you.
And hopefully we're going to see you sometime soon. Maybe it wouldn't be more than a year, maybe hopefully soon, and then you can come back and then talk us more about dental health. And we are so appreciative of your time, and we thank you for coming.
Thank you so much.
All right, so I'd say for Dr. Octchere and Kwame Kono. Now this is Mohammed, and so Mohammed, you have about 30 minutes to talk about things in Ghana, Mohammed. So if you're ready, let us know, and then we can link you on, and then we can talk more about mental health. So we're taking a quick commercial break, and then when we come back, we talk to Mohammed.
Minia ba eni ma medufi oye dwuma odukasi anopa biara minia ba sori ahoɔden mu na ɔkwadwuma on complaining da sɛ ho ba bitutu no sanso na mebra o efitani o tu engine ni o pagya engine de ka adwuma sɛ de sitie da bi biara no ho dendenden mia meyire o store no adi ni dwa meyire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanam papa ne mfia konkan ɔno so complaining da sɛ de ho ba bia ne ya ɔsori anopa na no afanse kan no ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de beda mpo na adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a wonom a ebo ni padua no ema wo se pi usita me kanfo ama wo se won so no kowa mesha ni bi na baboa na aboa no obusua na yare da ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. Say wo pe kwa mixture ato ewa America brochi memu call One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadi nkratuo yi agiatum se eye.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Just one more pick, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT1179663.
World Remit, a better way to send money. Download the app or visit worldremit.com.
And then Tasanya Mohammed Bio Mohammed. Now Mohammed, I know so demonstration cost so the Mohammed. What's on card? There cost
Many Kwame, maybe I fine for Ghana. Let say what I mean, car.
So how to come out and I don't capa.
What do you say? Kotoko there. What the Kotoko now, dear son? And she necessary. The Kotoko bar. Jacob and I was say, I could radio. For your mamma feeling, when he had a movie sensation. Mamma Ghana, no Canana Morgana, a bit me, a free form, more Nantia, better gate, China. Yeah, my mom was the only couple of room. But then, if you know, I bet it was stadium at you cry, I don't cry, a feeling. It will be say I have for it at you for
Okazaka say because you know, I'm a target and near of a farm, a cocoa, what do you say? That's all.
Kwame, we are sure.
I am
I same way there. I just said, Minia, I could see the more ever confirm with mammy. I guess I found there. Yeah, your money there anyway. Yeah, near 8 minutes and Nancy. Just say, oh, Nancy, my middle ground. I say, pressure, a woman has them go to her. Near for 5 minutes and you'll be gate free. There's a no cry out there. Oh, Krana, they're called your fans. And you know. And then Yaba Stadium.
Now, any other question in terms of health?
Kwame, in terms of health, Nema Bibre, Koso, Ghana. Now, it be a good news. It be so bad news. Minim say, whom yeah. Is it clear? Okay, good. And you know. Bibia cost said I'm a kind it be a good it be so fine. Come him say COVID there be I said that we are may they shall say free COVID-19 this week and I said now here a media yes I say COVID no new variant about Ghana so the new variant some not crowded to China COVID cases you know Emma na home so various senior secondary schools and universities. But don't forget to say current weather you almost see you know our bread and I say Katani and I say Minkan say cold you know weather moon I want and yeah symptoms be say by shada enye the one answer no COVID no dey no ho be fry no ntina say ama ebinom abo ehu saa no. Na one thing so it sounds so etene say aban ana say asoye ehwe apomde so eguso bo the road no say wona onwo omo vaccines e be say ommo monde ana omo nko omo vaccines no na obi ho a kwa oba ko on sanwo obi me say the last 2 weeks na me kan obi adwene say the road na yebo no kra no this time I am the road bi so COVID no eko enti oma wa na bosume num ne na chi omunko e no ye besere se omon besan so akọ Kwame don't forget say booster no na so for some time now na e bi aba Ghana but nipa dro na so nim eno so ho asem so we no so asoye hwe apomde so omugu so ebo mod even though it isn't the best but then I know they are trying and some of us there be a share and you say booster no and so honoma e be shese mo e be kwa akọ so kwa de te COVID cases no se me de COVID 7 de to nchen a menua monkeypox last week me ba be ka say monkeypox you know who Ghana yes but asaya e hwe apobuden so be deny say here I call na we ye dey afi dey enya bedru minu so sa time na wa betete monkeypox abetete Ghana border no you know this time no wetimi asiniki abewram enti as last week asaya no my numbers say enipa num ena enya bi wo regions and I say friends yes regions organ regions means so northern region Eastern that was last week and when say na okay ABC means so update for ebesan so about monkeypox of one Kwame no so yentimi enche so yegusu ayesre atifo ni ahefo se se something so na say ensenchene eche so be na monkeypox no say the padron na social media so ni ade but omo mu hu se ko se hu se ebia ensan bi sisi on sa ho na ho ahihye nsuo ne de ka ho na dia isi na apai ne kwa Kwame ya yinchiwe krasa na yefre bi ntos esi wa na apai ne nsufi bi firi mu ba etimba acha na se nsisi wa isa to be friend nsisi wa ye hwe ma anya say nsisi wa me ma experts and as a professional and confirm say no we dey nyama people nsisi wa and as say ntos and say friend say sa nyama na esisi and those days now they are because some people to say they are common organ say antibiotics will be able to work into a community pharmacy and I say any center a group no akoto antibiotics no but me there be sa who sa symptoms na obey fast na o de akohu doctor and I say pharmacist na wetimi kwade ba ko a we was make and say COVID by na ebinom no vitamin C pa nyina na no vitamin C dey sanso bi fruit say vitamin C sematwam wakachi obi so obi ndi vitamin C kra na o say COVID comedy vitamin C and as mean didi emfanya be enti ye besre eti for say omummo modern ana omundi hudu kwa me da bia da no last 2 weeks me share journey bi ase metete ho keke but ma nu finfin makona wiye eye asoya ehwe apomde so eni asoya ehwe sikasam so Ghana Kwame nurses no post in nasem na meka ye no say no dia meka de abetwam ni say though I can't confirm say enu ntira ma enipa no bi hwere o mon kwa de that one I can't confirm some of us are having some perception Kwame could you believe we say just about these few weeks umudi and I said nurses be for a minimum ena ewu Kwame wu na omawu no ne say omo kwa akọwo ena wawu ọkọwo ena wawu these things as kane no esote kakra o Ghana but see eya ama ne ho so e Ghana eya dey very alarming pa say obi ono no obi kọwo a ena ọkọje na wo ne mo nu mu no time so nso ọkọwo no mo wu Kwame eya dey a e wo say ye ma ye ni se ne be ya say ekom the nurse fo no bi and all my hockey can work for ma so that we can sort that one out. And yes, be idea be hiding because I come the woman. Kwame, I can sometimes nurses kasama woman. I can sometimes only be patient, Kwame, and also I've been a victim and I know so within the Americans. So some of these things I have my too passionate about it. Say sometimes one kasa unya nurse ni na waba in fact you don't have to know the person or nurse and answer on your nurse but how you welcome the person na wa no I think idea ehia pa sometimes as a health worker oko hospital na unya complain na oko report ya Kwame they will be bold enough to tell you say o kire ho dodo we keke we na we complain idea bizarre. Mom hoya can wait me taking pan on. You come there. It's about 5%. Anything ya say akukodro no etimi kokache doctor say and as etimi koye report say no this case I'm going to take it on, but nipa do na nya say akukodro no. So I think say binumu 8 ye akomde ahefo ene asoyefo so mu tutie ya omo momo de na say ehihye bi wo ho a ye de be consider say look, as a health professional this is what you should achieve before you close. Say 8 hours now you say 5 hours now you, because by the end of the day now proactive because health workers don't know who say or be complaining in pain hysteria like as a so as a we win, but seriously attention. So Kwame, brain drain idea hard Ghana had to say Mr. Ria Obinim say me reporting just and then already Yellow Stars Yellow radio everything live to the US live it's Yabaho but I see so ever quite it's Yabaho baby Pablo, the best. Yabaho.
As if for Mohammed or reporter live. From Kwame Sports Studio. And then for sports, they room for health awareness. How ironic. When I was in the mobile and also what happened to Mohammed videos, I Kotoko, my sponsor the more man I would have with Rana. The interviews. The updates me now so or the air brain. I said, I'm for a family so man and the granatico. And you say,
okay. What's the yes, Masamba, we did a chief for now from Famina. Sports in the
sports into your mama time.
But Kwame, I don't know if I am back. If you can hear me clearly here. Good. And you know, now me kasa about brain drain. Kwame, brain drain once one American. I mean, when nurses do not if you Ghana. Yeah, nurses from Ghana, health workers do not know if you Ghana. We will be say me nurse na chan come na kwa na sama kwa. I say we party me kasa me man come na kwa na meboa, because if you consider the kind of pay omunya e wa hanum say now how many months be take ansa na ba eden, but though me encourage say omunyina ankonja nya say me na na yare oyo man here no me papa yare me ami mu me yare me oyo man here, but it's been a open secret. Nurse from Penifua or Madagana, no, they've been complaining, but it seems obedient to one because a Kobasa Umu use come to the chance and you post you so the chance and a pita. Kwame, I think we are trying to do some research now as time goes on. Remember, figures are almost every year. This year, over 2,000 lessons. Yeah, after over 2,000 lessons in the figure. And if you Ghana and idea it's agenda 111 no. My main diverting from agenda 111. Say I'm here agenda 111 and you're ready no. I used to call Mufanche Katie and the Akika Mokolana Yakopenko for Momba because Sierra Afimuna in Cabo means nurses are Yandy Sika train 2,000. And any agenda 111 year ready the my main so far Eastern Regional Hospital and also agenda 111 so far make us say first phase next week we will try and then get some pictures for you on few hospitals agenda 111 regional hospital I now maternity block for family who could do many pair did that for me as a we there oba there adawroma they are almost done omo abiem ama kese omo painting mu nyina enti no aka say kofo be sha ase akom na emom no ye hia ne say Kwame enye ne foforo ne hia edi 6 months ni state no be yeden edi 1 year ni state no be yeden because e ka me say Ghana fo nya ademono a ye pe na emom se be ya ye be maintain no eno no ewo fom enti these are some of the things was yedi ho eduma Kwame me de no to nchen motor accident and accident cases car akwanhia some of ko soropa wo Ghana me can mana ko say accident ba ye dey near these are all emergency cases Kwame ho last week me the pictures be send there say ye be kwa to accident so na nipa ni bi nguye na Kwame omo mu be pagya no asem Kwame say obefre ambulance na ambulance number I've been complaining several times say one district one ambulance ye de jami ase because obi kan wani ibo na te do mosi so wuni bi to obi do ma bro ba kwa na emum no how can the whole district enya one ambulance Kwame ade a eye we pa enti no ye befre ambulance makopie accident no so nipa mienu na ba ko da accident a omoti moto so na car abo omo ba ko akoto left ba ko akoto right and omo da ho and it's on Kumasi Accra highway on sa kwan no kwa de bia me ka ho asem de bia me ka ho asem say at least minia obi be ma suggestion bi na very okay pa but at least yakoma say hospitals ni nyina e nyampo a na say nya sa particular road no na yibenya hospital emergency hospital was so then the big towns Bunsu Konongo Kofodia we inside dodo but nkoko sa o hono baby no at least because I mean almost every day accident is almost every day I will try and get some pictures for you that the middle of the road no e mo tutu iron rods APP feme so who means iron rods na you say what do you expect accident ni see na besi but e besi na e be free ambulance ye gina fa free 20 minutes ambulance BMba but then over 20 minutes ambulance BMba we have to stop trotro any exercise omugu na because of any expect in and I say omo anu expect in lifting you know Kwame nipa na ka say obi didi on fanche nipa na ka say apia fa ho ne kotodwe no na upeja o tiem ajeje and so we had no option that to place the person in trotro na ye de no eko so it been idea a hard win pa e wo hand because emergency cases no ye timi and tackle and na me susu say eno na ma so far no mortality rate and I say awo chiwu and I will be called wu no I match and because yeah emergency system e wo e form pa I mean me mean ka we so ansa na mako me say mortuary Kolebu mortuary mo assemble social media obi anka ho hwe on say Ghana no asem nya betwam a neko asem nya betwam a neko I was expecting say ye be charge obi a ohwe mortuary no so say ye den na efunu nipa wo wu hu nsuo son ti be wura gatamu ne de keka ho but ye nte ho hwe bi renovation atiki place o senya atiki place o Kwame ye nya nte ho hwe bi and you know some of us you follow up on and we are hoping to get good results and no honko hono na obitim siki ya okoye sa video no buy in fact when siki official okoye sa video no buy but there are so many hospitals at distance in Ekoso but everybody seems very quiet ewo ho a offense omo enkan we ewo ho Kwame nothing so semester so atwa so a
Mohammed
Kwame Obama 2 minutes anka enso me de na emum enam se me wo stadium na ɛwɔ sɛ megye yɛfrɛ ne sɛ mene animo ɛso ba abɛto aso nti no bɛfa ne saa na Kwame obi kɔ akɔwo na ɔte yaw obi kɔwo na ɔte yaw
obi kɔ akɔwo na ɔte yaw hɔ na Muhammad Frizi say you know the one to say we cry abomodin pass to imagine so for that long because now I'm expecting to be a back at some point but it's me and no man can seven baby na update no one or the abraye no and on that note no ye na ya end this show na fe no we the akwasini sorry free akwasini mo no response crew no o long time ago why be that just say I'm the power sponsor no Beryl to me sorry ya no I'm ba to us and same time next week you know catch the unia and also catch the unia say Echo Radio no ya back and I feel so health and wellness and so you also at the same time next week you know but then ya me jam makram so for Kwame Manu makram